Nitazenes are a synthetic opioid, which means they're man-made in a lab. They have no purpose in terms of medics or human consumption, and they are particularly dangerous for human consumption. They were originally made back in the 50s and 60s in a lab. In Northern Ireland terms, though, we have seen nitazenes in our local drug market from probably the summer of 2021. When we first became aware of nitazenes then, and we've seen it in heroin being adulterated with nitazene. So the heroin was cut with that particular compound, and then it had an impact on people who were taking the heroin and causing more overdoses than would have been expected. As a public health agency, we were particularly alarmed, as were a lot of our partners, around this new substance on the market. The first thing we did is worked with our colleagues in police and in forensics to get a sample of the nitazene and get it tested to understand what we were working with. So we are aware that they're in the market, but they're certainly not, they are dangerous, there's no doubt about that, but they're not one of the main concerns because we see very few of them in the market. There always is an opportunity that if something happens across these islands, that it could also happen here in Northern Ireland. We've seen that with cocaine, we've seen it with heroin, and we've seen it with nitazene in the past. Our sense is that actually our biggest issue at the minute, as I say, is alcohol, cocaine and ketamine use, and that idea of polysubstance use. So we don't currently anticipate that we will see an influx of nitazenes in the local market. That being said, we work on a daily basis with our partners in police and in border force and with forensics to identify, stop and detect those substances. And if we see an upward trend where more nitazenes are being seized and also tested, then that will necessitate then some messaging from the public health agency around the local market use and harm reduction messages for individuals that would use substances.